it's very important to have high index of suspicion, especially in children who eventually may come down with gastroesophageal reflux disease. So when a child is being fed and you discover that the child keeps having certain symptoms either in the ear, the nose, the throat, or voice change by way of hoarseness or coughing or choking, this child may be having reflux at that point in time. So positioning of the child while feeding may actually help reduce this symptom. And after feeding also, proper position. You don't just feed the child and then lay the child on the bed. There's tendency for reflux which may be fatal in certain cases. So the lower esophageal sphincter is actually a true sphincter, and in this case there may be failure of the lower esophageal sphincter, which is one of the predisposing factors to gastroesophageal reflux disease. So the lower esophageal sphincter may be weak. In certain cases also, when a child has certain condition, hiatus hernia, or in cases where there's transient relaxation of the lower esophageal sphincter, a child may actually be predisposed to gastroesophageal reflux disease. Also, in cases where you have neuromuscular disorder like the upper GI dysmotility, in cases where we have gastroparesis or retroperistalsis, a child may be predisposed to gastroesophageal reflux disease. Also, when a child is fed either via NG tube or passage of NG tube in adults, may predispose an individual to gastroesophageal reflux disease. Other conditions include infant fed with formula milk. Infant that have intolerance to cow milk may come down with gastroesophageal reflux disease. There's also been gene on certain chromosome, the chromosome 13, the long arm of chromosome 13 have been implicated in gastroesophageal reflux disease, in predisposition to gastroesophageal reflux disease. Clinical presentation usually is heartburns. A patient may present with heartburns, which is the most common presentation in those with gastroesophageal reflux disease. Also, in certain cases, which is not common, chest pain, there's a retrosternal or the epigastric pain. For some, they may complain that it radiates to the back. In some cases, you may have other symptoms like globus, which is a sensation or feeling of foreign body in the throat. Difficulty with swallowing is also another symptom of gastroesophageal reflux disease. Hoarseness, nocturnal asthma, tooth decay, because due to the reflux. The reflux may actually cause tooth decay. So when the tooth is examined and tooth decay is noticed, then you suspect that there may be a reflux in this patient. Other clinical presentation include regurgitation of food or feeds. A child regurgitating frequently may actually be having gastroesophageal reflux disease. Colicky abdominal pain, and then of course